Community continues to expand access to health care across the Central Valley and recently implemented state-of-the-art blood pressure monitoring for pediatric patients to help diagnose hypertension and other underlying diseases. Pediatric nephrologist Dr. Elizabeth Black explains why this is so important.
Hypertension or high blood pressure is a growing issue in children. It used to be that we thought of most high blood pressure in children as being what we call secondary hypertension. So that's high blood pressure that is caused by a medical problem in our body. Now we're seeing, because of changes in lifestyle and because of the growing problems of the obesity epidemic, we're seeing more what we call primary or essential hypertension.
To help address this growing problem, Community has implemented ambulatory blood pressure monitoring, or ABPM, for pediatric patients, a device children take home to help monitor their blood pressure.
It takes a blood pressure reading a couple of times during the day, and it also checks while you sleep. And it gives us a really good idea of what your blood pressure is over a long term.
This technology helps diagnose in addition to other tests.
So when I have a child who comes in with concerns for blood pressure, there's a few things that I do. I usually do blood and urine tests. I check their blood pressure very carefully in the office myself, but it's also important for most of our kids that we do an ultrasound of their heart called an echocardiogram, and depending on the age of the kid and what we see on some of those blood and urine tests, also a kidney ultrasound to look at how the kidneys are formed and to look for any changes in the blood vessels that go to the kidney.
Our kidneys are part of the system that regulates blood pressure, so sometimes high blood pressure could be a sign of a kidney problem.
Renovascular hypertension is a kind of high blood pressure that is caused by changes in the renal blood vessels. That is often something that children are born with, or it's the result of a sort of a genetic issue that manifests when they're pretty young.
Dr. Black and her team can order a renal ultrasound to see if there's any obstruction of the kidneys as far as the urinary flow and all of that. But more importantly, we can check the renal arteries.
Joy Guthrie performs testing in the non-invasive vascular lab for pediatric patients.
So we know that kids who have high blood pressure it goes untreated for a long time have a really high risk of having things like heart attacks even when they're pretty young.
Having access to specialists and technology like this close to home means better outcomes and follow-up care for these patients.
You know, these are our people, right? This is who we serve, this is who we choose to serve. And our families can sometimes have problems coming due to access of care. Maybe they have one car. And so to be able to provide the service in days or hours instead of weeks or months before they can get their problem diagnosed is huge. The administration of this hospital has always seen the entire family. And I'm very proud to work here because of that.